Fragile X. You've heard the term. Most of us don't know what it means. So here to answer some of our questions, Dr. Gary Feldman. And Dr. Feldman is the medical director of the Stramski Development Center and Miller's Children's Hospital in Long Beach, California. And he is here to tell us, what is Fragile X? Dr. Feldman.
Hi, everybody. Thank you very much for inviting me. What is Fragile X? This is a genetic condition. It is the most common inheritable form of intellectual disability, and occurs in approximately 1 in 4,000 in the population. Being a genetic condition, it's inherited. Usually as a X-linked condition. In other words, it's usually coming from, it could be a mother or a father carrying the X chromosome. And it tends to affect boys much more than girls because boys only have one X chromosome and one Y, whereas girls have two. So if they get the condition, they have one affected chromosome and one normal, so it kind of washes out the effect. So why would I be talking about Fragile X syndrome on a program that's dealing with autism? And the reason is because about 30% of these children that have this condition will actually have autism. And in fact, about maybe between 4 and 7% of children that are diagnosed in the beginning de novo with autism may end up actually having.
Oops, he's frozen just a little bit, and we might need to reconnect with him. But I'm so glad that he started answering the question about why are we talking about this, because it comes up in autism conversations all the time.
It does, and I think we don't. I never knew what the relationship was.
I didn't either.
Yeah,
I knew the first thing when Jem got diagnosed, they sent us across the hallway to get blood drawn to rule out Fragile X.
Okay.
So that was the first thing that got discussed when Jem was diagnosed, and it came back negative. But I hear about Fragile X a lot, and always wondered, why is this so much of a conversation? Because we know it isn't as prevalent, but hopefully we're going to be able to get. He's back.
Dr.
Feldman is back.
Dr. Feldman, you're back. Dr. Feldman, we were just saying you answered so many of our questions, because I had here, first of all, are there ways, what's the relationship with autism? Is there a genetic predisposition? And you have told us that it is genetic in nature. Is there a way to test for this prior to families starting a family?
Yeah, absolutely. I mean, there's a genetic test. It might help to understand. I'll be very sort of brief in terms of what the underlying mechanism is.
Okay.
So being a genetic condition, they've identified that the problem is on the X chromosome, and what actually happens is there's a gene that is designed to manufacture a protein called Fragile X mental retardation protein, which is an awful sounding name. And every one of us who are not affected with Fragile X actually have this protein. So you might think, oh my gosh, mental retardation protein. Firstly, it's a horrendous name, but we all need this protein to function normally. Now, on this chromosome, when you have the defect, what actually happens is this gene, without getting into too many details, develops what they call these trinucleotide repeats. And the more of these repeats that you have, the more likely you are to have the condition. So to diagnose Fragile X syndrome, you need to have 200 or more of these CGG repeats in order to sort of have what we call the full mutation. But that's not all. It also depends on what we call methylation. In other words, if the gene is methylated, it means that it's turned off. So individuals that have sort of the full condition of Fragile X will often have more than 200 of these CGG repeats, as well as being fully methylated. And having said all that, I lost the track of your question.
The train of the question, though, is very interesting. The train of the question was, is there a test that can be done, a prenatal test for Fragile X?
Right, and so part of the genetic testing is actually, what they do is they test for these CGG repeats. And this can be done prenatally as well. So they can do the test and see, well, do you have more than 200 repeats, which would make you a full mutation, or could you be a carrier? And so what happens is, for instance, if a mother is a carrier, she would have between 55 and 200 of these TGG repeats, which means that she may actually function completely normally, although carriers may have certain issues that they have to deal with, but in all intents and purposes, they are functioning normally. And many carriers don't even know that they are carriers. But then once they produce a child, the chances of them producing a child who has the full mutation is much, much greater. So, yeah, there is a prenatal test, and you can also test postnatally under certain conditions. And the most common conditions of why you should test a child for Fragile X syndrome would be 1, if they have intellectual disability, 2, if they have autism, or 3, if you have a child who has, say, speech and language impairments and maybe some other issues, maybe a little bit of intellectual disability, maybe some social issues, social avoidance behavior, you may be inclined to want to test for Fragile X syndrome.
And what would that test be, Dr. Feldman?
It's a blood test, just a genetic blood test.
And is this common to, let's say, I mean, my child has autism. I don't know if he's been tested for Fragile X. You said Jim has.
When we lost you, I said the very first thing when the doctor diagnosed autism, she sent us across the hallway to draw blood for a Fragile X test, which came back negative. But it was the very first thing that she did, and I've always thought that was interesting because I hear from lots of parents that they've never gotten tested
for Fragile X. Is this something that is recommended for any child with autism to be tested for Fragile X?
Absolutely, it is. Let me give you a quick anecdote. I saw a patient the other day with autism who's been a patient of mine intermittently for years, lost to follow-up for a few years, and I actually inherited this patient when I started here. And at the last visit, I was looking at him, and I noticed that he had some behaviors which were a little bit different. He had a sort of extreme gaze avoidance, but extreme, to the point where, he would like turn his head to the side, and almost be afraid to make any facial or eye contact whatsoever. And that's one of the behaviors that's very common in kids with Fragile X. So I asked some questions. I said, "Has he been tested for Fragile X?" And the mom said, "No, but I'm a carrier." So yes, the answer is that it is prudent in any child that's been diagnosed with autism is actually to do the genetic testing. So you may say, well, why?
Yes, my next question.
Yeah, what difference is it going to make?
Why? How are we going to take that information and use it to help our child?
Yeah.
Okay, so the difference is essentially falls into 2 camps. The one is, it's a genetic condition. So, you've produced a child with Fragile X, which means where did this come from? So a parent is a carrier. And this has implications in terms of if you're planning to have other kids, what are the chances of your progeny having this condition? So it's got to do with family planning, but it's also got to do with Fragile X associated conditions, because women that are Fragile X carriers are at risk of having what we call FAX-POI, which is Fragile X associated premature ovarian failure or insufficiency. So they have early menopause. Usually older men that are carriers have a much higher risk of actually developing a sort of Parkinson's type condition with dementia. So it really does have ramifications in that sense.
It sounds like there's so much conclusive research on this. I'm kind of thinking, why do we not know this kind of thing about autism? It's very interesting. Has there been, is there adequate funding to explore Fragile X as an expert in the field, being that you are?
No, funding is always an issue, and there's some really exciting research that's taking place right now looking at targeted treatment for individuals with Fragile X. Without getting into too many details, there are a number of drug companies right now, as well as individual universities that are actually looking at ways to address the effects of what causes Fragile X sort of at a molecular level. Because the theory is that because you don't have this Fragile X mental retardation protein, which acts as a sort of a controller to stop a rampant, uncontrolled protein development in the brain. So if you can kind of control this without having this controller protein, if there are other ways that you can control this unregulated protein deposition in the brain, you may be able to actually change the picture, or maybe minimize the symptoms, or maybe more than that, prevent this theoretically from even occurring.
Well, that sounds interesting.
What is the treatment?
Yes.
If you have a child, they've been born, they are diagnosed with Fragile X and autism, let's say, what treatment is there for treatment and care are there for Fragile X?
Okay, so the treatments are very similar to the treatments that you would do for children with autism. For instance, you've got the behavioral treatments, and that may, we don't have to go into details, a lot of behavioral treatments. We've got the learning supports, the speech therapies, et cetera, and then, you may have to resort to medications. So in terms of behavior, essentially you're dealing with very similar things. You're dealing with emotion regulation issues. You're dealing with anxiety. Now, kids with Fragile X have extremely high anxiety levels, really high, much higher than what you would expect in a child with typical autism. They often have ADHD-like symptoms, difficulties with concentration, difficulties with hyperactivity, impulsivity, and then may have aggressive outbursts and a lot of self-injurious behavior. It's not uncommon for these kids to do excessive hand biting, and a lot of our patients actually have huge scars on their wrists and fingers from biting, from the sort of stimming type behaviors. So, there are medications that we would use very similar to autism for that. But in terms of the sort of behavioral and learning supports, these children have very sort of almost specific types of the autism has its own little nuances. In essence, yes, a lot of them do not communicate well. They have profound speech and language delays, but they seem to be more aware of what's going on around them in terms of language, and their receptive language or their comprehension is usually a little bit better than kids with a typical form of autism. And so the way you deal with them and the way the interventions have to kind of be fine-tuned to adjust for the relative strengths and their weaknesses.
Wow, that's fascinating.
So, doctor, would you recommend that any parent that has a child that's been diagnosed with autism get a blood test to find out if their child has Fragile X?
Absolutely.
Okay.
Absolutely.
And is this kind of blood test available through their pediatrician, or do you need to go to a specialist?
This can be done through any doctor's office. All you're really asking for is a DNA analysis for Fragile X.
Okay.
I mean, that's really what the test is.
Now, you brought up methylation before, and so in the autism community, when we start talking about methylation, of course, what comes up is doing methyl B12 shots. Is that found to be at all effective with kids with Fragile X?
Yeah, so just we've got a semantic issue here. So I'm talking about methylation in the context of genetic testing.
Okay.
Not in the context of treatments.
Okay.
Right now, no, B12 and vitamins have not been shown to be effective. However, having said that, generally speaking, there may be some benefit with antioxidants in preventing or slowing down the progress of this condition, but it is still kind of highly theoretical right now.
Now, when you say the progress of the condition, is it progressive, and does the child, does it worsen as the child ages?
Well, it doesn't necessarily worsen in the sense of, like you're talking about dementia or something,
Yes.
where like a degenerative condition. It doesn't. It's not a degenerative condition, but the brain is constantly plastic, and the neurons are constantly changing. And so, if we were able to control the neuronal plasticity and the sort of what we call synaptic pruning, you may actually theoretically again improve the conditions. So the body, in terms of antioxidants, the body is constantly doing things all the time, and if it's doing bad things all the time, you're trying to stop bad things from happening. So it's really sort of trying to find things that will regulate and stabilize a condition so that you can actually make gains rather than keeping a condition as a status quo. Does that make sense?
Yeah,
Absolutely.
and might some of these treatments, Dr. Feldman, be applicable to autism when a child has a diagnosis solely of autism?
Yeah, there's a lot of overlap. In fact, some of the research that's taking place for Fragile X, some of the products actually have been studied in typical autism as well. without getting into details, the sort of mGlu-R5 theory, and looking at how you can actually stop this unwanted production of protein. And so some of these study drugs actually have been used in kids with autism and are still being looked at. But provisionally, these drugs may be helpful in terms of social avoidance behavior. They may be helpful in terms of promoting speech development. They may be helpful in terms of reducing anxiety and possibly even hyperactivity. And some of these drugs are actually being studied right now, even in adults, for treating depression, and may have promise.
Interesting. Very interesting. Now, we want to get to the Fragile X Association of Southern California.
And we're almost out of time,
Yeah,
but we especially want people to be able to have someplace to go if they have more questions. Emily has been showing the Fragile X Southern California website as you've been talking. Is that the best place for them to go for more information?
Yeah, that's a great resource, a local resource for anything related to Fragile X syndrome. And of course, there's always the National Fragile X Foundation. And you can just Google that. And I think I sent you, I think that maybe I have a link that I sent. National Fragile X Foundation is a huge repository on Fragile X, much like the Autism Speaks website. It's a huge repository.
Okay. And tell us a little bit about the Fragile X Association of Southern California and what their mission is, and do they have events that the public can support?
Right. So their mission primarily is a twofold mission. The one is really to promote awareness of Fragile X syndrome, and certainly, just like the platform you're giving us now, it really helps us and helps them promote the knowledge about Fragile X. And the other thing also is to provide a forum of support for families. These parents and kids get very stressed, just like any family with autism. So it's a support system, support group, helping to advocate, helping to educate, and then also indirectly support scientific research. They're a nonprofit, but they're able to support in the sense of, helping recruit patients that may be, or parents and patients that may be interested in some of the studies that are taking place. And then next year, in 2014, they will be actually hosting the International Fragile X brain freeze conference.
Yes.
In Orange County.
In Anaheim.
Okay.
So they've got a big task ahead, and there's a lot of fundraising and organizing that's required.
Well, Dr. Feldman, you have been a wealth of information.
Yes,
I've certainly learned about this, and I'm going to definitely go back and make sure that Wyatt was tested. I do believe he did get that test. But the bottom line is that if you have a child with autism, you should test for Fragile X. There are ways to treat this condition. It's very important to know if you're a carrier, and there is help. Dr. Feldman, thank you so much for joining us today.